Did you have a good night's rest? Yeah, good, good. Well, I'm going to show you some things that you can do to help yourself rest. And one of them, and that's something we didn't get yet, is we're going to start with hot and cold foot bath. Maybe I can borrow this chair. Somebody want to, yeah, is there anybody here has some problem with your feet? Maybe even have too many calluses on your feet? All right. Well, we're going to demonstrate a foot bath, and then we're going to take a few moments to demonstrate the contrast, hot and cold foot bath. And this is just so you know that there is a difference. Well, yes, you come to some of these classes and you get some information, but how often do you use it?
Unless you use it, you lose it.
Okay, so that's what I'm going to encourage you here today, is try to use it as much as you can. All right, so, oh, this is probably going to be fine. Would you like to touch that or put your foot in it and see how, does that feel like it's going to be okay? Okay, so I'm going to ask her to put her feet. How's that feel?
That's okay.
Is it hot?
It's warm. It's not.
Not as hot as you could.
I could do it.
Okay. The other thing I'd like to talk about is the fact that when we, now I kind of like to have people warm, right? So you need to put a blanket around them, and even this is not, this is a foot bath, but you can use this. We could actually combine this with, maybe she's got a cold. All right, so we're going to make sure she's covered up. On top of all this, so we're going to do a number of treatments all at once, and we're going to talk about different ones, okay? So this is one of the most important ones you're going to use. It's easy. Maybe you came home tired from work and your feet just hurt. You can use this. Maybe you're coming home from work and you've got a headache and feel the beginnings of a cold coming on. Might even have a small fever, but you need to knock that cold out. Yeah, like Muhammad Ali, knock it dead out. So anyway, if she's coming home and she's tired and she's acting like she's getting, coming down with a cold, we're just going to go ahead and start her with a nice warm foot bath and put this blankets around her to keep her warm. Give her lots of water, and I like to start with warm water, not hot, not coffee hot, but on the hot side of warm. So nothing to burn the tongue. And then on the head, while we're warming up her feet, we put a cool cloth. Okay, but you can have a bowl of cool water over on the counter so that you can refresh your mitt or your washcloth. Once she starts getting warm, you need to just bathe the face. May I do that? Even though, sure, I'm going to mess up her. Okay, so you can just. So what was your name again?
Denny.
Denny, yes, Denny. Thank you, Denny, for being our demo. We have somebody else who's has volunteered to be a demo, and he's already ready to go. So anyway, and you can put a cool hand towel around the neck, okay? At this point, she's not hot yet, so we're not going to freeze her out. But that's warm. Okay, I'd like it to be warmer, so we're going to make this nice and warm. Lisa's got her feet. Okay, would you mind picking them up? And let me pull this out a little bit. Yeah. There you go. And I'm going to pour it in, and then I have her feet out because I don't want to burn her. But she said that wasn't very hot, and that's fine because I like warmer water too now. Okay, so now You just cover this up, and the blankets come over the bucket, and it kind of lets all that heat come up her body, right? Yeah. And these, by the way, are wool blankets, and you can get wool blankets. You know where you can get the wool blankets? Where's the best place? Army surplus, yes. And I'm always going to Army surplus every time I can see it, just to see, is there anything I need? So there are many ways to use a foot bath. One, if you're going to do it like for tired feet or things like that, then you can just use a hot foot bath and end with one dash in the cold. Or you can take a cold towel and use that cold, icy friction, cold mitten friction on your feet and dry them, and then just go to bed. But there's another way. Now, this is what we're using here, and again, with that warmth, you might want to just, and you can put the coolness over their head. I'm not going to mess up her hair too much, okay? And again, you can put the cool towel around the neck, right? All right. So then there is an alternating, all right, there's an alternating hot and cold, which we're getting ready to do. But before that, I want to teach you about warming socks. Did you bring your paperwork back from yesterday? Is it on your papers now? The warming socks, yes. Okay, so the warming socks, basically, you put your feet in the hot water, and it will stay hot. I think that's pretty warm this time, right? Without being overly. Right. You want to not burn somebody. So it's not your tolerance, it's their tolerance. So you understand that some, big young man, of course, or athletic girl will come in and she says, oh, that's not hot enough. But she's working on her grandma. And grandma's a little older, more frail. You don't, Thinner skinned, yes. And I will tell you, I run into this kind of thing in other countries. They don't have hot water over there most of the time. They don't have hot water. They're not used to putting their feet in hot water. And you go to put them in hot water that I can tolerate, and they can't even put their foot in it. So I had to learn that something a little more tepid was plenty hot for, say, somebody down in Guatemala and Bolivia. But they learned that they could do it if I didn't go so hot and so cold. So it always depends on the person that you're taking care of. And again, a child is not going to be able to take the intense heat and the intense cold. So be sure that you're thinking of your patient. So with warming socks, you see she's had her feet in the water, and for 10 or 15 minutes, you leave them in the hot water, right? Then afterwards, you take some cotton socks and put it in the cold bucket. I got a lot of ice in here. All right, get those nice and wet. I'm going to dry her feet off, and then we're going to bring this down here. Now we're going to what's called warming socks. We already did the hot foot bath for 15, 20 minutes, send them to bed, cooled off their head, got them ready to just go take a nice nap. It's very soothing to the feet after they've worked a long, hard day. And if they've got calluses, you can scrub the calluses off after being in the water for a few minutes. All right, so we're just going to open this, and I'm going to dry off her feet. And you see how red it's starting to get red? So the water's, the hot water is nice and warm. We're just going to dry it. And again, with somebody with older, who's older, you don't want to necessarily friction too much at the beginning. But I'm going to have her just rest that for a minute. Okay, so we've dried it off. Now, these are called the warming socks. Why in the world am I calling them warming socks when I just pull them out of the ice water? All right.
See if I'm paying attention.
Okay, so these are the best cotton socks I could come up with. You know, did you notice it's very hard to find cotton socks? That's one place you might be able to find them at the Army Navy surplus store. Possibly. You can also get your wool socks at the Army Navy surplus store.
So is there one in Spokane?
Yes, there is. There's a couple, yeah. Then you take your wool sock, looks like a lumberjack, and you put that right over that. All right, and sometimes it's hard to get them on over that wet stuff, but eventually they will go on. So you can do that to both feet, and then you can go to bed, and it will eventually warm up your feet and make them really nice, and it will draw down any congestion. Say you're starting to get a sore throat or a respiratory infection, or maybe there's a young person who's having menstrual cramps, or maybe there's somebody who just has a belly ache from, I don't know, there's so many things that can give us belly aches these days. But anyway, then you can put these on and dry off their feet and put these on. You notice I'm putting the cold water over the hot feet. Cold socks over hot feet. Those feet are going to warm up the socks, right? And then this is going to open up the vessels in the foot and in the lower leg and draw congestion out of the upper body. It's good for headache. Headache is usually caused by congestion. And it will help somebody to stop coughing, and it will ease the headache. It will ease menstrual cramps, usually, and it will also help somebody sleep. So for any of those reasons, and then we'll go ahead and cover. So after this, she goes to bed, right? And then that's at nighttime. In the morning, she'll probably go right to sleep, but it may take a little while. And they say this is best if you use it 3 or 4 nights in a row. So if you've got a cold and you do this 3 or 4 nights in a row, you get used to doing it. First, people don't like those cold, wet socks on their feet. Well, and then you wake up in the morning and you say, man, what happened? I went to sleep and I didn't feel a thing, and your feet in the morning are dry and they're warm. Walk around the house, they're warm. And and you don't have that congestion, you don't have the headache. They come back and you can do it again the next night. You don't have to if you don't need to, but usually if you're coming down with a cold, you might need to. But it feels good no matter what. All right, so how's it feeling? Is that one I did foot, is it get warmer yet? Not yet. It's going to take a while, so I'm going to have her put her feet. But that's how you do it, and that's what it's for. Did it talk about all the things that you can use it for? All right, because in some of these books, it will talk about everything you can use it for. Okay, so now my friend's come to me. She said, Sherry, I have twisted my ankle. I've got a strain or a sprain. It's just really killing me, and I can't get to the doctor, and I just can't afford urgent care. What can I do? So I'm going to set her up with a couple of cotton cold buckets of water. So go ahead and put those back in the hot water. Okay, so after a while, your hot is going to be cooler. Thank you. And you'll need to freshen it with hot water. Okay. Thank you. Right, if you want to experiment with other things, but Epsom salts, you know, I would rather take a whole Epsom salt bath because it's a detoxifying agent, and we do have information about that today we can go through. and it will help take the toxins out of your whole body, not just your feet, okay? So that's where I would use Epsom salts more. And you can even take a salt scrub in a shower. You just kind of have to turn off the water, so you might be cold, but Epsom salt usually comes pretty coarse. I have noticed that some of it's getting a lot finer, which you can then use, and you mix a little bit of water in the Epsom salts to make a snowball so that, you know, you might throw it. But you get your body wet, and then you can take that and start at your feet and scrub the Epsom salts on your body, and then at the very end, rinse it off. The other thing is just take a nice 20-minute to half an hour Epsom salt bath in hot water, but one that you can tolerate. Keep cold on your head. Why do we do that? To protect our brain, right? Protect our brain. You can put cool cloth here, cool cloth here, and keep your brain cool. Okay? Okay, so we're going to do the contrast bath. Now she's spending 3 to 4 minutes. Okay, used to be that the age-old adage was 5 minutes hot, 1 minute cold. Then I learned, okay, you could do 4 minutes hot and 1 minute cold. Lately, and I think they went to the scientific room in America, who doesn't have time to do these things, and they came up with you can do 3 minutes hot, 30 seconds cold, 3 times. I would recommend 3 times is the very minimum. We're going to go from the hot now to the cold, and it's going to, and that's kind of. Let me get this out of the way, and we'll put this over here. All right, so, and we're going to, somebody keep a timer on there, 30 seconds. Maybe you can help keep me on track, okay? But anyway, so we're going to go back to the hot. Was that needing more hot water, or was it plenty hot? It was hot enough? Okay, all right. So you see the first change might be hot enough. Second change is going to need more hot water, and each time after that you're going to need more. And do you know why the second time you're going to need more hot water?
It's the cold feet.
Your feet are used to the warmth now, and it can go hotter. You know, we've talked about this in classes and with more people that have done this, and they say food quality buckets, because there's dyes, there's toxins in these other buckets, and this plastic, and so you want food quality, and that's what these are. Okay, anything, yes, Winco, I've gotten a lot of my buckets from Winco because it's rather handy from where I work. Okay, so we ready to go back into the cold bucket yet? Somebody's going to have to keep me. Okay, somebody's going to have to keep me on time. So this is number 2, right? Or is this number 3? Okay. Anyway, so we're going to do her whole treatment, and we're going to continue to talk. So I don't like to do partial treatments. This is a package that a friend of mine, he's a doctor, and he says this liquid IV for emergencies. It's got nutrients in it that you may need. Of course, if you've hurt your stomach, you're not going to want to take it orally. But if you don't have a problem with your GI tract from mouth to the anus, which is a medical term, okay, we'll use it. Okay, from the mouth to the anus, you can take one of these with water and get your electrolytes and get things to help restore dehydration. We were talking about dehydration the other day, and it will help to give you the things that you need, right? And they call it, it's a liquid IV, but it also gives you your electrolytes. Now, most IVs do not necessarily give you all your electrolytes, but they do have sugar water in them. Some have salt water in them, which again is an electrolyte. So it's just a way, if somebody's been injured, you can't get them. If it's a bad injury, you need to call an ambulance, right? And you're not going to want to give them oral stuff. If it's a simple injury, they've been out in the heat, they're going to need something like that, right? But remember that if it's a serious injury, don't put anything in their mouth, right? If it's a serious injury, they need to see a doctor, get to the ER, don't put anything in their mouth. And get them there as quickly as possible. Call an ambulance, meet the ambulance, do whatever you need to do, but get them there. All right, but a lot of people are having congestion and nasal problems, and it's just a problem. So I learned a long time ago about this thing called the nasal cup. It's also known as a neti pot. How many have heard about a neti pot? Okay, so you have to use purified water in this. You don't want to add garbage to your sinuses. That's how come, and I forgot to bring, we'll just use one of these. Okay, so you want to use pure salt, and pure refined salt. This is Neomed, and I'll show you that in just a minute. But I want to show you, you just put your, does anybody want to do this? Really? Okay. All right, well, I'm going to feel this. And do we have a clean spoon that we can maybe mix this with? Okay. Okay. Thank you very much. All right. So then, we're going to let her be our demo. Okay, can you come back here? Okay. Now, we're going to go in one nostril. It's going to run out the other nostril, so you want to catch it in the bucket.
Okay.
Okay? Does that sound?
Quit laughing. I grew up with older brothers, so you can imagine what just ran through my head.
You might want to get your hair out of the way. Okay. Yeah, there you go. Okay, you do this. You hold it. I'm going to let you do that.
What do I do?
Okay, now let me stir it a little bit. Okay, this is the neti pot. This is beef. Okay, there you go.
I just,
Put it in this nostril,
okay.
and then it's got salt water in it. Just let it pour in there, just hold it.
Oh, that's weird.
You see it coming out? Okay, now, stop, and now, and see, okay, yes, a
My
towel.
brothers would be proud.
There's one, right? There's the towels up there too, so thank you. Here you go. Now then, I want you to do it the other way. If you did saline water from a sterile thing from the hospital, you can use that, all right? Normal saline, if you buy it, it's already sterile, it's clean, I would say you could use that, okay? All right, so, so do the rest, do the other side. There's a towel right there.
Should I blow my nose?
Yes, go ahead, yeah, put that down and go ahead and blow your nose, and then come and do it some more.
Okay.
Write down Neomed sinus rinse and neti pot if you prefer. So there's two ways to do it. Neomed is a little more perhaps convenient, but because it comes with its own stuff. But Walmart, Costco has it. The ears are something different. Now you will have eustachian tubes, but wax buildup in your ears is something that's totally different. Okay. All right. Yeah, thank you. And the other thing, they do have eardrops in the store that will help take that out, but you have to do it regularly, right? Keep that earwax remover in there that it will soften that ear stuff, and then you can take a warm syringe, hot water, warm water syringe, and put it, I've done this, I'm a nurse, So you put a little thing under to catch the water, and you put it in the ear. It sounds loud, so you want to be sure and not overdo it, and be careful. You don't want to go all the way in to puncture the eardrum. So this is something you don't want to stick it in there. You want to be very gentle and squish it in there and help that stuff come out. In the warm water, hot water, without burning the person. Remember, no burning the person. All right, will help. If you rinse it out, that hot water will make it softer, and eventually it will come out. Now, a lot of times you can just go to the doctor and have him remove the earwax. Right, okay. And that is a good thing to do. Okay, are you keeping track of all these things? Okay, what did we do for the feet? How many things did we do? 3 different ways to do the feet, right? There's a solid 15, 20 minutes, ending with a cold, and then good dry, go to bed, right? Then there was the contrast bath, the hot and cold, and then there was the warming socks, which again is a solid 15, 20 minutes warm, hot, and then you dry them off and put cold socks on with wool socks on the outside, right? Okay, and we need to learn about that.
That's where you leave them on, right? All
That you leave them on all night. Yes, absolutely.
you add onions, I hear that onions.
If you want to put onions on those hot feet, that's great, because onions are good, and of course that blood circulation down by your feet is close, and so you'll take that onion juice that your feet are in, and it'll take it through your body and clear up to your ears. All right, so now I want to show you, while we have the hot water here, we're going to talk about another way of cleaning out your respiratory, your nose, and that is through steaming. So we're just going to, there you go, we got hot water, and we're going to get down there and capture the steam and breathe it in. Get it right down there. And so this one's not too low, so I'm coming down to it. And I can breathe in this steam. And you know, you're going to want to have Kleenex tissues or something to blow your nose close by. And this is going to clean out, again, your nasal passages. And you can actually, if you've got a cold, you can steam like this for 5 to 20 minutes or 3 to 20 minutes, okay? And I'm hoping that I didn't hurt anything. Okay.
What about adding the eucalyptus too?
Yes, and you can add a drop of eucalyptus, and you can put the eucalyptus in there. Just 1 drop. Well, that was a whole lot of drops. So don't shake it, just let it drop. All right, so then you see how this, if you leave the lid up, it will continue to boil, all right? And so then you can do the same thing. And I like to get one huge one.
Huge towel
Yeah,
or a blanket.
or a blanket, okay. And I do have perhaps a small blanket over there. Yeah. Here, hang on, we'll just grab this right here. I know what. Okay, so this is just a flannel sheet, okay? And you can just get it and capture, see it's a little bit bigger, and you can capture that and make your own steam room. Now I kind of put my arms out, and I let that steam come up to me. And I'm breathing deep. You can actually put this down on the ground and let it come up to you. Put a big blanket around you. You want to try that?
Okay.
Okay, we're going to take this and put it on the ground. I have used this for myself. I have used this for my elderly father-in-law. He's 100 years old. He died at 102. And, okay, so now I need a big, here. This, we got these. Okay, come on over here now. Yes, thank you. We'll save that for the fomentations. Okay, ready?
Just put this.
Yeah, you can put it over. Throw it over your head. It'll keep you dry. And we're gonna put this. Just put it over your shoulders, and we're just gonna have you hold this. So this.
Okay.
And what I'm thinking is that I'd like to make one with PVC pipe, something that will hold the blanket in place, so you actually have your own little sauna, right? Or steam room. For children, you can actually get in here with them. For my father-in-law, who was 100 years old when I did this, I was in there with him. I had him sitting on a chair. I put special towels on both legs so that it didn't burn him. I put it on the ground, had him lean a little bit, and I was under there with him. so that I knew he was not going to be burned. And I could breathe it, and I had him sit up, not get, you'd get down, no, it's hot. How you doing?
Oh, I'm fine.
Is it better now?
Yeah.
It's a little farther away, right?
Yes.
So,
It's not
so you
burning my
can,
face.
right, it's not burning your face. And that's the thing. You have to learn not to get too close. Let it come to you, right? I recommend these books because, well, this is the man that taught me hydrotherapy. And then, so we've done the hot foot bath. And down here on the back somewhere, you'll see warming socks. I think it's in here, but it may not be, but I thought it was. Yeah, but the warming socks is on your handouts. And he also taught me the warming socks. It's important. So then the contrast bath, and it should be under contrast bath. So your charcoal poultice and suspension, which we learned about yesterday, is right there. Your steam inhalation is right here. Now we were going to talk about ice pack, and we'll do that with massage. Ice massage, ice pack, paraffin bath. Now paraffin bath, you know what a paraffin bath is? And people with arthritis, you can actually buy a little container, and you can put your hands down in this paraffin, and you pull it out, and put it back and forth several times. It will coat your hand and make a glove for you. But that is a paraffin bath that is good to pull out toxins out of your arthritic hands. Okay? You can get those paraffin bath places sometimes in Walmart and Rite Aid and Walgreens. And so that is something you can do. All right. So we're going to do hot fomentation, and then we're going to do massage. So an ice pack, you know what an ice pack is. I'm going to tell you an easy ice pack. Just go out and buy yourself a sack of frozen corn or a sack of frozen peas. And you can use that as an ice pack. Now, if you don't use it too many times, you can eat it too, but after a while, and get yourself a new one. But you can use that as a cold pack. And talking about warm packs, I wanted to introduce you, and you probably have seen these. This is the thermophore. So you will find out that these are hot, moist, heat thermophores. This is my older one, and it's in this big box. And you see it's nice, and will go over the whole back. And this is a moist heat pack, right? And it's important to use moist heat. But the local water bath, we just did a local foot bath, okay? And I want you to know, where are those? There they are. If you have problems with your arms, these are the size that you want for your arms. So you put hot in one, cold in the other with ice, and you can take this teapot, and I always do after I get it going, I take a teapot or even a pan with a pour pan, and you can keep that covered so it stays hot. And then as you're going back and forth from the hot to the cold, you can just reach over and pour some more hot in. And you can do that for yourself if you're alone. Well, remember when you were in, I said, what if she sprained her ankle? What if she fell and hurt herself? And, a lot of people are falling, and they're hurting their hands as they're going down, okay? So you can actually put both of them in there. You know what I use a lot is my double kitchen sink. There's the hot and cold right there, and I still have to have the hot water boiling next to me because every time you turn that off, it starts all over again. So you have to have it handy, right? So, but yes, you can do it for one thing that I got kicked in the shins, right in the knee, right actually underneath it, right here, by a colt. And I had bought him, and he was kind of partially wild. Anyway, but he gave me a good kick right there. And I tried to, this was before I knew a whole lot about hydrotherapy, but I told him, I says, I got kicked by that colt. It was months ago, and it's still bruised and sore. He says, Sherry, do the hot and cold. And like I said, she, why she knew? She was a PE teacher. and had gone through and they do these things in PE, all right? Taking care of muscles, taking care of sprains and injuries. And I said, but it's 2 months old. She said, it'll still work. And that's why I'm telling you the story. Even if it's 2 or 3 months old or 6 months old and you still have problems, it will still work. And that's really good to know that you can take care of that. Now, the wet sheet pack is something that I have read that most doctors say that doctors worked with it. It is the one that they use the most, okay? I will tell you that if you have someone that is getting manic, out of control mentally, they need a shock, okay? You can throw them in cold water, but the other thing is you can put them in a wet sheet pack if they will allow you to, and that will help calm the nervous system. We get a big sheet and we put it in ice water, and he just took a warm shower. All right? So then this is where they have to get their clothes off, but they can keep their underwear on. But we're just going to pretend, okay? All right. So now this is a cold sheet, right? So how you feeling, Rick? It's kind of cold, you say, you know. Okay, so we're going to put this under, and then we're going to put this. Oh, we're trying to keep him as warm as possible. And you usually have 2 people doing this. So, and then you bring this in, and you notice I put this one here. So that's on both legs touching. We're going to mummify him. We're going to put him right in here and put this cold sheet everywhere. And you've got it under the arm here, and we can, that should have perhaps been a little longer, but anyway, this one is going to be plenty long. Why does this? Yeah. So anyway, you get this in here and wrap him up. And then we're going to get him as quickly as we can wrapped up in this one. And we can put one of these neck things around the neck. Oh, yeah. Yeah, we've got to be careful with your neck. Yeah. All right. And then this, again, is brought over. And you notice it isn't long enough to do everything I want it to do. And that's the reason why we've got this one. And you can tuck it in. And if you look on what page is it that actually shows the way to fold people up in this. And this, we could have actually had it down here longer. But that's the reason why you have to practice with this sometimes and get in the habit of doing them, right? All right. So it's pretty good.
Yes, ma'am.
All right. How do you feel? You feel like a mummy yet?
Getting close.
Getting close to feeling like a mummy. Okay. So then the other thing is you'll take a cool, or just keep him. If he starts perspiring, which you remember I put him in cold. Remember the warming socks? That in the morning they warmed up and they were really hot. So he's going to be in here for a couple hours if he can tolerate that. And that he will be, if he can't warm it up, then we put hot water bottles under the arms and on the tummy. If he can't warm it up, we put them on his sides. I couldn't warm it up, so they had hot water bottles all over me, okay? And so that's, but you want their own body heat, because he started out with a hot shower. So as soon as he comes out, and something you didn't see, he took a hot shower, came out, and you have this all ready for him. As he gets out of the shower, dry him off, and he goes right on here, all right, on the cold. And his body heat from having that hot shower should help to dry out that cold sheet. And you're with him all the time. The one thing about these treatments is that you never leave your patient. You know, he's kind of in a bad place. If the place was burning down and I ran out of here, can he get out very easy? He can't get out very easy. Your responsibility is your patient, okay? You can't run out just because you freak out about the fact the place is on fire. You got to get him out. And as nurses, when we are in the hospital and something happens, we evacuate our whole hospital, right? We evacuate people first. So you take care of your patient. Don't let any phone call or any, remember we have these phones that are rather, they intrude on our lives, and you don't even pick it up. Turn it off at that time when you're doing these treatments. So this purpose and effect, to regulate the heating and cooling or evaporation of the body so as to control body temperature. You can do this for a fever. All right, to cool a heated, feverish body, to heat a body to sweating, to quiet the nervous system, to relieve internal congestion. You can have internal congestion. A lot of people, they can't have a bowel movement. They can't do, because everything's just kind of inflamed inside or congested and nothing's moving. So, indications, okay, for a cooling stage, and you notice that there are degrees as we read through. There's a cooling stage, there's a neutral stage, there's a heating stage. And page 48 says the antipyretic is an antipyretic for fevers. Now then, the other thing is, when you have somebody laying down, you might want to put something under their knees. Can you pick up your knees a little bit? Okay. And I can lift that maybe a little bit. Okay, so that will take off any pressure on the low back. Does that feel better?
Oh, perfect.
Good, good. All right. So antipyretic, what does that mean? Get rid of fever, right? Okay, neutral bath or neutral stage, insomnia, mania. Remember I talked about somebody who's kind of just out of control. They know there's too much anxiety, delirium, and that could be delirium tremens even. Okay, restlessness, nervous exhaustion, nervous indigestion, and hypopepsia. Hypopepsia means not enough stuff to help you digest your food, so you're always in a state of dyspepsia. If the person is not a big, strong man with a lot of body heat, you may want to do it with a dry sheet, and this will tell you that too. Okay, contraindications. You don't want to use it for diabetic or those with poor circulation. Patients with severe colds or influenza is not one that you want. Feeble persons, people who are not very strong in physical body, in their health. They have real bad, or if they're elderly and pretty feeble, right? If you can still use it on an elderly person, but again, you will do it with a dry sheet, and you stay with them all the time, right? Okay, you do it with a dry sheet, and let's see. Then there is skin eruptions. If you're having measles, chickenpox, and stuff like that, you don't want to do this because it will just, it's going to heat up the body and they're going to come out even more. So, okay, so equipment, material for a hot foot bath, yes, and you can put their feet in a bucket of hot water if they need to, okay? They have to bend their knees up, and somebody might have to, make sure the hot water or the bucket stays on the table. But all right, material for a cold compress, which we've already, the cold compress for his head. As he's getting hotter, we're going to once again take that cold ice water cloth and be sponging his head with it. Okay, since we're just cool his cheeks, cool his face, cool his head, right? Keep that cool. All right, then, let's see. For the heating stage, which we were talking about, the heating, sweating stage. Now, each one of these, you'll find out that each section takes a little bit of more time. The longer he's in here, the warmer he's going to get. All right, and that's good for alcoholism, for nicotine poisoning, to get the alcohol out of the body. Pretty soon, you're going to find that that wet sheet under there smells terrible. Okay, if you want to get nicotine poisoning out, for gout, for bronchitis, common cold, influenza, jaundice, measles, scarlet fever, to help develop the eruption. So if there is a reason why you want to help develop the eruption, now this one says skin eruptions, okay, is a contraindication. And then here, this fever one says you can use it for measles, scarlet fever to help progress and get it over with. So you're going to have to decide what you want to do with this. This kind of leaves it up to you. So it says here, warm the person up with a hot foot bath, a shower or fomentations, or an infrared lamp. So we had him take a hot shower. We already talked about that. Prepare the treatment table or a bed. Now we have a table here, so we try to prepare it. You can see that it takes a little bit of practice in doing this proper. And you have a page in here. It tells you about how to fold it, right? Right. So that will, and it tells you how to fold it so your whole body is covered. And that's what I should have looked at there. Okay, so you see how this one covers underneath both arms and comes over, and then this one goes over the top of both of them. All right. So two large sheets, a bucket of cold water, a Turkish towel, fomentations, one hot water bottle or a hot water bottle or infrared lamp. And you may want, like I said, to have more than just one. And then if you couldn't heat it up, you put those water bottles under his arms, over his tummy, even under his knees if you need to. All right. Now, one of these days, we're going to do that fomentation. You ready?
I'm ready.
All right. All right. We'll get him untangled because he's really tied up here. All right. Rick has said that he would be our patient for pillows. Yeah, for yeah, I think it would be good to. Is it okay if we actually do it?
Oh, sure.
All right. Okay, so in that case, though, he's not going to need the pillow because I'm going to have him on his tummy. The one thing, when you have somebody on their face, you want to put a bolster under their feet to protect their toes. And, oops, sorry. All right. And, yeah, make them comfortable. Okay. All right, so we put this on so I could have access to his back. But till we get ready, we're going to cover him and keep him warm. All right. Now, there's a couple ways you can do this. One is by the pot, and I'm going to show you how to use the microwave and how to use a pot. Let me get all my towels, what I do with everything. Okay, now then, we're going to use towels here today, but you can also use this thing which is called a fomentation pad. This one, I think for him I'd like it to be bigger but wider, but when you make one, you make them kind of one size fits all. But this has to actually get wet and then roll it up, and you do about 5 of them, and you put them in the oven for a while. And then that moisture will get warm, and when you're ready, it comes out of the oven, and you have to roll it in. This is a piece of wool that's been cut so that I can actually, when I get ready to use this, because they're pretty hot, you just roll it up in here like that. And then you can put it on his body or put another, if it's pretty warm, then you're going to put another towel around it as well. Okay? So you want to put it, so put this down over him. Now this, I'm just demonstrating this in case you ever do want to use it like that. So you can put this hot fomentation in onto his skin. I should do that so you get a real, okay, so this is not warm yet, but we're going to pretend like it's hot, okay? So you put that there and cover him back up. And
Would it stay warm longer if it's in the oven versus?
It should, because, well, this, we don't use this in the microwave. This is for oven use. The other things that we're going to use in the microwave are towels. And that you have towels at home. I'm going to show you how to do using towels in a microwave. I wanted to show you too how I use a hot pot, because when you're using hot water, which you might, if you don't have electricity, you can't use a microwave, right? So you want to know how to use a hot pot, because you can always boil that over the outside fire if you need it. And then if it's hot enough, you want to have nice gloves. Now you notice that these are not just kitchen dish gloves. These are fortified. I can put my hands in pretty hot water and they're protected. Those little dish things, you put them in there, you burn yourself really fast with those. So this, yeah, I got these from I've got one set from the chef's store, and another one I got it in the probably, where was it? It was in the Tractor Supply, close to the place where you get your wood stove stuff. Okay. So anyway, those gloves will protect your hands. All right. So you leave this on for a few minutes, and then when you go to take it off, you get your cold mitten friction, and you do cold, and you take that off of there, and you friction him really good with, and the way that you can do this too, if you have just a washcloth, you wrap it around your hand so you can hold it like that. Okay? You have just a washcloth, that's cold. It's in ice water, it's cold, right? And then when you take this off of him, and you just take this off to his back, then you give him a cold mitten friction and you dry him off real quick, all right? Everything, once you get doing this, it's fast. You cold, dry, and get him covered up. Again, this towel is fine because this is the hot one, right? So get him covered up and get another one put on, and you do it several times. I'm sorry, that keeps going over. That shouldn't hurt. Anyway, so that's how you do it with the one in the oven, right? Okay, so now we're going to show you two ways to do it with towels and hot water that you bring, one from the microwave and a different way, the hot water from the stove, right? And you go by your directions. Usually we do that several times. See, now this is boiling hot water. If I were just put this on him without anything else, would he like me? No. Okay. So cover it back up, and you notice I've got my gloves, and he doesn't have gloves like this. Okay. So we're going to get this ready here. All right. So I'm going to show you what I do and what I've been trained to do. Get this out here. You can take it, test it on your arm. That's pretty warm. So I'm going to go like that. Cool off. It cools off pretty fast. Now, Rick, I'm going to put it on and take it right off, okay?
Yes, ma'am.
Okay. Does that feel too hot?
That's perfect.
Really?
Oh, yeah.
Is it still okay?
Thinking.
Is that okay?
Yeah, we'll try it. I'll holler if you
Yeah, don't be too macho now. Okay, so then we're going to, let's just take this blanket. Now we're going to cover that up, Rick, okay? That too hot? You stay right with him, and you're checking with him all the time, okay? You check them all the time. And you do with this way, you do 2 hots and then a cold. All right? So I'm getting the other one ready. How's it feeling, Rick? Okay. And again, this is pretty hot water. So what I'm aiming for is 3 to 4 minutes of hot. And if I need longer than that, you're going to need a third towel, right? Or you can dip the other one back in it and reheat it. But does it feel like it's cooling off? Is it? Okay, we're getting ready to put another hot one on, okay? And it's pretty fast, and so it's always nice to have a helper. Thank you, Judy. Ouch. See, I just got it on my skin, and I said, ouch. All right, so then I'm going to put this right here. Would you cover that up for me? And I'm getting this. And sometimes your helper can be right in front so they can help you with this part too. But again, that's pretty hot, right? So maybe I should have waited till I was ready to go on. But you can check it on your arm. You can take it. Okay, Rick, here it comes. How'd that feel? Too hot? Huh?
A little warm.
Little warm. You notice I didn't leave it there because I know it's going to be too warm, right? All right. Better? You sure? Maybe not. You notice, even though he says, okay. All right. How's that? Better? Okay, then I cover him up. And the other thing is if you have your wool, which I have this thing all, you can put your wool underneath the blanket and over that. So it will actually contain it a little bit better and maybe keep it warmer longer. How's that feel? It's okay? And even though he said it's okay, well, I keep checking with him because sometimes I'm not quite sure it's going to be okay. Now, the one thing in your kitchen, or, this seems like a good place to do it. Set up in your kitchen if it's big enough, or the dining room where you can get everything. Or in the bedroom, I've done everything in the kitchen, then I bring it all here to be by my side. It's not clear over there, it's here, and I have things on the dressers where I can grab them. Usually, if I have to do it by myself, but it is nice to have a second person. All right, so we're going to put one cold one of these on his back for 30 seconds at least. All right? Okay, here comes the cold one. Yeah. Can you come over here, Judy? I can't get this up. With these gloves here, I can't get them done. Cold you can handle with your hands, right? Okay. Just go ahead and take that off. Here we go, Rick. Okay, now we're going to get him covered up again. And we're going to count. Can anybody time it for me? 30 seconds cold.
15, 27, 30.
So, all right. So after this, we're getting ready to do the hot again. Yeah, you notice he's ready to get that off. Now, it's getting warmer, isn't it, Rick? Is it getting warmer?
I think so.
All right. Yeah. We're past 30 seconds? Okay. So I want you to know that this goes pretty fast. So we need some more hot water in here. Just bring the teapot if...
Oh, you want the teapot?
Yeah, just add the teapot to it. Because it's got to be real, they're not going to go back to the store, they're going to add the teapot. See how much water you spill? Yeah, just pour it in there. And maybe half, that's good, that's good. We'll need it next time. All right, keep your hot hot. All right, here we go. And we're going to take this off and put the hot on, but is that too hot? You can't. Let's leave it there, okay? See now, he can tolerate, is it still okay, Rick? Okay. He can tolerate it now because he's had hot already and it's made him be able to tolerate a little warmer than at the beginning. So you do this 4 times at least, right? 4 times back and forth at least. We're on the second time here. And the last couple of times, since we've demonstrated the pots, now the last couple of times, what if we'll demonstrate the microwave, okay? But one of the times I did this, I was kind of new at it, and I forgot to tell my patient that I was going to put it down and take it off immediately. And please don't do that. She thought I was going to leave it there, and she just came up out of there. So it stayed on her longer than I would, because you put it down and you take out. And she actually, by sitting up, took it out of my hands and left it there. And oh boy, I got a tongue lashing. And like I say, you have to tell everybody what you're doing. But I was new at it, and I hadn't done it for a while, and I forgot to do that little part. And so she sat up really, and took it, in doing so, took it out of my hand and left it there longer than would have actually been. So this is something you need to talk to your people about, let them know every step of the way what's going on. Here we go, here's the cold. Still gasping. We're going to just transfer to the microwave. Ready? Okay, you notice I leave the cold. Thank you. Look at her hands. She's okay. She needs the gloves. Yeah. So, Rick, this is from the microwave. How's that feel? Sure. Okay. Okay. He said, is it okay still? All right. The cold was cold. Okay. The other one, we need to have the microwave running. Yeah, get it warmed up. Thanks. Thank you very much. Anyway, so again, you do 2 microwaves, and you notice I did the same technique. Kind of cool it off, check yourself if you need to, put it down, take it off, ask him, can they tolerate it? Because they want to be, you don't want them to burn. And you notice, even though he said he could tolerate it, I'm double checking as I'm laying it there that it's not really too hot. But we're going to give him a cold mitten friction, at least on his back. But when you're doing somebody in a home situation, you've got them covered, they've probably been perspiring everywhere, and they need a cold mitten friction to their whole body, okay? And you start, if you have them rolled over and the thermophore is on their back while you do this on their chest, when you're done, you can do their chest, you can do their arms, you can have them sit up, do their back, get rid of the thermophore, have them stand up, dry them off, have them stand up and do their legs. Or you can do their legs while they're on the table or in the bed, okay? You ready for the last cold?
Yes, ma'am.
All right. So this is where, look at how, can you see his back, how red it is? All right, so I'm going to take these off because I need to hold this. And a drying towel. All right, so again, these are made for cold mitten, or for cold mitten friction. But the one thing I don't like, I would put a thumb hole or something to keep them from going around the circles. Here we go. How's that feel? Okay, so you do that, and then, okay, Rick, how about sitting up? And let me get you out of here. And then I'd like to do your arms. All right. Oh, and then we'll dry him off, okay? And all right. Take that off for a minute. All right, so you just do the whole thing if you can and dry him off. And it's okay if I do your chest? We actually probably need another one. Although I did turn it the other side, so it's probably good enough. But you see, even his chest is red, so he's probably been pretty, huh? That's right, we'll just, yes. We've got it, because you notice that cold mitten friction is fast and frictionish. You've got to friction it, And you're not being too soft about it. Now you want to know that if you're doing somebody more feeble, you're not going to want to use quite as heavy a friction. But yeah. All right. So then, here you go. And